Good evening. I would like to welcome everyone here to our event. My name is student Dr. Rosenthal, and I'm a second-year medical student here at Southeastern University. I'm also a member of the executive board of the Addiction Medicine Club. I and some other members of the Addiction Medicine Club put this event together with the intent of exploring legitimate pain management as well as the propensity for abuse of pain medications. Unfortunately, there is no more appropriate place to discuss this topic than in Broward County, Florida. This is not something to be proud of. South Florida has grown a nationwide reputation as the place to go to obtain prescription medications, regardless of legitimate need. Among the statistics, a new pain clinic opens in Broward County every 3 days. Doctors in Broward alone dispense nearly 10 million oxycodone pills a year, and more than half the illegal prescriptions in the country come from South Florida. This past month, State Senator David Ehrenberg of Green Acres did some research and discovered there are more pain clinics in Broward County than McDonald's. As a physician in training, I'm very concerned. Not only because of the risk that these illegitimate pain clinics pose to the general public, but because of the broader risk that they pose to patients in actual pain. There's an obvious need for legitimate pain management. From patients in acute need with broken bones or post-surgery, to those with chronic pain from arthritis or cancer, managing pain is integral in many ways to the practice of medicine. Illegitimate pain clinics, called pill mills, cheapen the practice of legitimate pain management. Tonight we're going to explore these topics. It's with great pleasure that I introduce to you our panel of experts. Mr. James Hall, Director of the Center for the Study of Prevention of Substance Abuse at NSU. Dr. Mark Steenhouse, Associate Professor and Chair of the Department of Osteopathic Principles and Practice at NSU's College of Osteopathic Medicine. He was recently involved in the drafting of administrative rules for the Florida Boards of Medicine and Osteopathic Medicine regarding standards of practice in pain management clinics. Dr. Raymond Obi, Professor and Chair of the Department of Psychiatry and Behavioral Medicine at NSU's College of Osteopathic Medicine. Dr. Carmen Pecker, a certified addiction professional and an internationally certified drug and alcohol counselor. He's also a licensed psychologist and neuropsychologist and a professor at Springfield College. Mr. John Giordano, a recovering addict and treatment advocate who has celebrated 25 years of continuous recovery. He owns and operates a 62-bed inpatient addiction treatment center and is the author of the book, Proven Holistic Treatment for the Addiction and Chronic Relapse. With Mr. Giordano as his colleague, Ms. Siobhan Morse, Director for the National Institute for Holistic Addiction Studies. We also have with us Mr. Raymond Farrow III, a partner of Addiction Recovery Legal Services and the Executive Director of Health Affairs for NSU's Health Professions Division. I would now like to hand this panel over to our moderator, WSBN-TV investigative reporter Carmel Cafaro, whose watchdog stories help bring the issue of pill mills into the public eye.
Good evening. What a heady group of experts we have here tonight. I'm not going to talk very much because I'm a reporter, and as a reporter I know a little bit about a lot of things. These folks know what we're here to talk about tonight, but I'd like to share with you a little bit of a conversation that I had on Friday with a DEA agent talking about the problems of pill mills here in South Florida. And he told me, and I know you heard some of the statistics, more pain clinics in South Florida and Broward County specifically than McDonald's restaurants. But we're talking about physicians here tonight, I think, because without the physicians, the pill mills would not exist. And it's going to be very difficult in the future to make sure that we treat people who have legitimate pain problems and that we don't feed addiction and feed drug dealers in legalized drug dealing. The only difference being from the cocaine cowboys is that these drug dealers are wearing white lab coats. And that's a quote from our sheriff. But back to the DEA agent, he told me of the 100 top prescribing, or top selling, the top 100 oxycodone purchasers in the entire United States. Of that 100, 95 of them are in Florida. And I personally think that's pathetic. So let's start tonight with Dr. Sandhouse and ask him how we tell the difference between a pill mill and a doctor who is treating someone with pain. Dr. Sandhouse?
Thank you, Colonel. Sometimes those lines are a little blurred, but from the administrative code that just got passed, the definition that they use with regards to the physicians that are going to be overseen by these rules